Hi everyone, just wanted to provide a summary for last week, go over one of the quiz questions, and then also talk about this week. So last week in class we talked about third-party reimbursement, managed care, managing the delivery, or sorry, financing the delivery of healthcare, those types of things. So a few points that I do want to make. Good work in our discussion about the Kind Heart Hospital folks, and I had mentioned this in the announcement as well. There are lots of things that we can do as a healthcare organization or as a CEO, administrator, to try and improve our financial standing. And I would be willing to bet any of you that have worked in healthcare, I think everybody here has in this class, you see areas where there's just so much waste, and waste in supplies, waste in staffing, not necessarily clinical staffing, that tends to be fairly bare bones due to shortages, but waste in administrative staffing, multiple people responsible for the same things, etc. So taking a hard look at your supplies and your materials management area, but then also taking a hard look at your administrative structure is really a good way to help address these issues. And another good way is really to take advantage of having a foundation for your organization that helps to fund some of that charity care. So most hospitals, most healthcare organizations now, nonprofits, are operating a development arm, which is fundraising. And this can really help to provide care to those through charity care programs, financial assistance programs, etc. So it's work that pretty much any nonprofit healthcare facility, it is mission work for them. It's part of their mission, and certainly something that you want to be able to do. But you also want to be able to provide quality care and keep up that level of quality across the organization. I haven't taken a look at the infographics yet. It's midterm here for our on-ground classes, so for the 8-week classes, so it's a little crazy, but I will dig into those here shortly. So hopefully you enjoyed doing that. A lot of students like the ability to have a little creativity, a little more exciting than just writing a paper on a topic. The one other thing I wanted to talk about briefly is cost shifting. And keep in mind that cost shifting, what used to happen many years ago was as a hospital, we would take a loss on, or physician practice anywhere, we would take a loss on charity care patients. We would take a loss on Medicare, Medicaid, especially Medicaid. Medicare doesn't pay all that badly, actually, when you compare it to what Medicaid pays. At least in where I come from, Medicaid paid very poorly. So what used to occur, and the textbook talked about this a bit, and we have video on it as well, but what used to occur was they would then shift that cost to the commercial payers, and it wasn't the reason I want to talk about it is it wasn't as if they were charging different amounts to different payers. Everyone gets charged the same amount. If you're self-pay, Medicare, Medicaid, commercial insurance, everyone gets charged the same amount. It's the fee that's set in your charge master. The way they did cost shifting was to make sure that their charges that were listed in the charge master, which is the master list of all charges within a facility, they made sure that those charges were above what the commercial insurance would pay. So by doing that, it kind of shifted the cost, shifted the burden over there and to the commercial insurance side. And when I was working in finance, gosh, 20 years ago now, it was 1999, I remember it. Is that 20 years ago? Yeah, that's 20 years ago. So 20 years ago, 1999, I was working as a financial analyst, and we had a consultant that came in and went through our entire charge master to make sure our charges exceeded. I also negotiated the managed care contracts for the facility to make sure our charges exceeded the amounts that our contracts would pay. And even you want to make sure that it exceeds. Especially at that time, there were many payers that paid us that we didn't participate with as well. So you needed to make sure that happened. That's not really effective anymore. Back then, many payers paid on charges, so they would pay a percent of charges. They would say, we'll pay you 80% of your charges or 95% of your charges. That would be too high. 85% of your charges, up to a usual, reasonable, customary amount. And that was kind of the norm back then. Now we've shifted, and this is why cost shifting isn't really as effective anymore. We've shifted to a world where payers pay a flat amount, and those commercial insurance payments, just like we're seeing Medicare and Medicaid payments decrease, we'll talk more about that this week, we're seeing commercial insurance payments decrease. So they're getting closer and closer to that Medicare standard for payment, and it's so that notion of cost shifting doesn't really work anymore because we have nowhere to shift the cost to. We don't have those payers that pay percent of charges anymore. Those are long gone. So they're paying a flat rate, very similar to what Medicare's payment structures, prospective payment systems, which we'll learn about this week, but they're paying in those types of systems, typically pay a bit more, but not a lot more like they used to. So just that note about cost shifting. So I do want to talk about one of the quiz questions. So the question was, which of the following is an example of managed care's attempt to improve the financing and delivery of health care while still holding down costs? So the answers were pre-authorization for hospital admissions, utilization management. Those are both things that managed care does, but in a lot of cases, those are not necessarily improving the delivery of healthcare. They may improve the financing function, but there are certainly many complaints about managed care and how they, manage pre-auth for admits or maybe expensive tests like MRIs and utilization management overall. Consumer-driven health plans are not, that's not really, that's a consumer, the changes, the finance changes that occur secondary to consumer-driven health plans are driven by the consumer. So it's not so much managed care driving that. There are plenty of consumer-driven health plans that aren't managed care plans at all. They're really just, go and get your services and then you pay for them up to a certain amount. Many incorporate managed care, so things like pre-authorizations, etc., for services. But really the consumer is what's driving the decrease in costs, secondary to consumer-driven health plans, because they're responsible for a $5,000 deductible, or maybe half of that. Maybe they have a medical savings account that from their employer that covers half, but then they're responsible for the other half. So it's really their own patterns of utilization of care that are driving down costs secondary to consumer-driven health plans, because they don't want to pay out of pocket. They won't rush to the doctor when they have the sniffles, something that can likely be managed at home, because they know they're going to have to pay for that visit out of pocket until they meet their deductible. But evidence-based case management is definitely something that is being used in managed care to not only hold down costs, but also improve the delivery of healthcare. So we're looking to use what the existing research on what are the best courses of treatment, what are the best ways to move forward with this patient that maybe has a chronic disease, chronic disease management programs, those types of things really fall within that evidence-based case management. And it's not just case management, it's the fact that it is rooted in the latest clinical evidence that makes it not only holding down costs, improving finance, but also improving the delivery of care, because you're getting the state-of-the-art care based on that case management. So that was the correct answer there, evidence-based case management. So that's the only question I had to review for this week. So let's take a look at this coming week. We'll be reviewing history of Medicare and Medicaid and talking about Medicare and Medicaid overall, and also a brief section on fraud and abuse, which is a huge problem with both Medicare and Medicaid. For your assignments this week, we have Flipgrid. I think some of you already got started on that. I apologize for not getting this up yesterday. It's it's been a little crazy. But we do have a written assignment, very short, 1 to 2 pages. Please do use APA format, though. Make sure you cite your sources, use the form, page formatting, etc. But just short, body of the paper, 1 to 2 pages. So key ways Medicare is expanded and evolved. And what do you think has had the biggest impact? Which of these ways that it's expanded and evolved has had the biggest impact on healthcare coverage, of healthcare overall? Even if you want to address that, that's fine as well. The important thing I want to mention this week is the final project topic selection. So you have a broad range of what you can choose from for your final topic, final project topic. So it's due in week 7. It's 5 to 8 page paper. Again, that's the body of the paper, not counting references and title page. But so you want to talk about healthcare financial administration, a topic of your choice. So anything you can talk about: ethics and financial management, role of the CFO, types of third-party payers, fraud and abuse, which is my favorite topic, coming from the compliance world, reimbursement systems, etc. So whatever it is that you might want to pursue for your final project, again, due in week 7. No writing due on that. No writing is due this week on that. But I do want you to write a paragraph or 2 about your topic. So don't just list the name. I want you to tell me a little bit about what you plan to explore for your paper overall. And then I will give you some feedback. Sometimes I have folks pick a topic and then I'm like, nah, you'll never get 5 pages out of that. So just submit them and I'll review them so that you'll have some feel confident in being able to evaluate the topic and get that kind of page number out of the topic that you choose. So that's all I have this week. If you have any questions, please let me know. And hopefully after today it'll slow down here a little bit. It seems like it's been nothing but turmoil and craziness for the past few weeks. So I'm hoping it slows down a bit. And obviously any questions, call, email. You're welcome to stop by office hours, and I'll talk to everybody in the Flipgrid. Thanks.